Chapter 3 in this course is concerned with gathering and appraising the literature. And in this course, you'll be doing two things with the literature. One is doing a critique of a literature review in a single research study. And two is a systematic review of the literature on a clinical nursing problem. Well, what exactly is a literature review? Well, it is a systematic and critical appraisal and provides the development and foundation for a research study. Now remember, in this course we're looking at research and we're also looking at evidence-based practice. The literature review is also essential to evidence-based nursing practice. Your ability to locate and retrieve research studies, critically appraise them, and then decide that you have the best evidence to inform your clinical decision-making is an essential skill to your current role as a student and your future role as a practicing nurse and maybe a future nursing researcher. The literature review in a research study is used to develop sound research proposals that will generate new knowledge for our profession. The literature review for developing evidence-based practice is used to uncover multiple sources of evidence on a given topic that have already been generated by research and can be potentially used to improve practice. The literature review in a research article, remember I told you, starts at the very first word after the abstract and runs up to just before the methods section. It can have various labels, for example, introduction, review of the literature, or it may have no title at all. The literature review from the researcher's perspective is something that facilitates understanding of the problem by identifying maybe a theoretical or conceptual framework to provide a context for studying, let's say, missed nursing care. It is also done, and this is very important for this class and for reviewing the literature on a single specific research study, is to discover what is known and what is not known, and to refine research questions or hypotheses. This leads to what, remember, I called in earlier lectures the identification of the gap, so you can stand in front of the blue suits and ask them for their money. Now, the literature review will help the researcher come up with a conceptual or theoretical framework. And this may be the basis for the development of research questions or hypotheses, which we've already talked about. And it's often illustrated using a diagram. It is integral to practice and to research. So if you look at this theoretical framework, you see that in the center there is the concept of missed nursing care. And it shows the little arrows where hospital characteristics maybe lead to missed nursing care, and unit and staff characteristics, the type of unit, the age of the staff, maybe the education of the staff, were there adequate staff, is there too much overtime, maybe some of the factors that lead to missed nursing care. And as you can see from our model, missed nursing care may lead to decreased job satisfaction or decreased occupational satisfaction. It also may lead to bad patient outcomes, such as pressure ulcers. So you can see where this theoretical framework can help the researcher develop their question. And as you're going to find out in this course, the research question, or the purpose of the research, drives the entire research process. Now, just to digress a little bit, I need to talk a little bit about some terms of theory. The concept in a theory is an image or a symbolic representation of an abstract idea. In our theoretical framework, missed nursing care is a concept. Hospital characteristics are a concept. Job satisfaction is a concept. Occupational satisfaction is a concept. Patient outcomes is a concept. Staff characteristics is a concept, and all the things that are listed under that are concepts. A theory, on the other hand, is a set of interrelated concepts, their definitions and propositions, which are how they link together, that provide a systematic review of the phenomena, which in this case is missed nursing care, for the purpose of explaining and making predictions, such as a researcher may say that increased missed nursing care results in bad patient outcomes as evidenced by falls. Conceptual definitions generally talk about the general meaning of a concept, such as missed nursing care, and operational definitions are the method used to measure the concept, so that missed nursing care, in this instance, may be 8 hours of time that the nurse is away from the unit being sick. When the concept is linked to a measurement method or instrument, it is then considered a variable. And remember, we talked about those, about the brown shoes. Concepts have levels of abstraction, and if you look at the slide, it'll be a little bit clearer for you. Suppose we wanted to study the concept of anxiety. At the construct level, it is considered an emotional response. You can see that's a broader category to which anxiety belongs. Whereas when we look at it as a variable, it's how are we going to measure this anxiety? And we can do it by measuring the sweat on your palm. So as you can see, it goes from the abstract level, which is the construct, down to the variable, which is very concrete. Finding the evidence, you're going to need to know the difference between primary and secondary sources. And this is going to be very important because I assume that most of you will go on to grad school, maybe go to be family nurse practitioners or nurse practitioners of some sort or the other. And in grad school, you're going to be requested to go directly to a primary source when you're looking up information. Primary sources are written by the person who conducted the study, developed the theory, or prepared a scholarly discussion. In other words, it is the author of the original material. Primary sources include original research studies, autobiographies, diaries, films, letters, artifacts, periodicals, or tapes. Now, secondary sources are written about or presented concerning an author's original work. In other words, somebody else is telling you what another author wrote. Secondary sources include critiques of a research study, biographies, and systematic reviews. But just remember, it is always preferable to go to the primary source when you're looking at research studies. Finding the evidence, primary versus secondary sources. Primary sources are essential, and it should constitute most of the literature review. Secondary sources, however, can be a valuable learning tool for beginners, especially if they include a research critique. There are different types of resources. There's books, journals, and indexes. Now, Refereed or peer-reviewed journal articles are the best choice because they contain the latest information. I'm going to talk about refereed and peer-reviewed research in a minute. Books usually take longer to publish than journals, so may not have the most current information. And print indexes are needed for sources that are not available in online databases. So, what is a refereed or peer-reviewed journal? A peer-reviewed journal is actually where a panel of scholars who are experts review submitted manuscripts. Usually the reviews are, quote, blind to promote objectivity. That is, the manuscript to be reviewed does not include the name of the author. The reviewers use a set of scholarly criteria to judge whether a manuscript meets the publication standards of the journal. For instance, I am a contributing editor to Nursing Science Quarterly. And every once in a while, I'll get a research article on it that has no name or affiliation, and I'll be asked to go through that research to make sure that they've done all the processes correctly and that the findings that they come up with are actually reliable and valid to be able to put into the journal. Now, there are several types of resources. You're probably familiar with some of these, and the Librarian came into our first class to kind of help us figure this out. There are online databases, and you use them to find journals and publications of professional organizations and publications of government agencies. And I'm sure you've all used CINAHL, which is the Cumulative Index to Nursing and Applied Health Literature. You can go into Medline, that is mostly medically based articles. PsycInfo, if you want to look at psychologically based articles, and the Cochrane Library. Now, there's a warning. Surfing on the web by using Google or Ask.com or other search engines is a very inefficient use of time. It can be very difficult because you put your information in and you come up with 2 million hits. And how are you supposed to know what is usable information and what is not, what is scholarly and what is not? It can be very difficult, especially for beginners, to judge the scholarly merit of the information obtained in this way. So, your librarian is your new best friend. You should visit your university or institution's library and ask for help in accessing electronic databases. They are experts and are usually very excited to help. You should also try to learn at least 2 databases. How far back should you go? Usually 5 years is good, but some advanced projects may require searches that go back 10 or more years. Systematic reviews, although secondary sources, can be helpful in deciding how far back to go in getting a scholarly overview of a topic. Now, sometimes it's kind of helpful to look at the reference page because it will tell you the publication dates of all the articles that they use to develop their research or their systematic review. And if an older article shows up in a number of reference lists, and it repeatedly does so, it is usually considered a sentinel one. So then it can be older than 5 years. It may be older than 10 or 15 years and still be a good source to use. Now, from the evidence-based practice perspective, literature reviews help to answer a clinical question or solve a problem to improve patient outcome by helping you identify and gather the evidence. It critically appraises and synthesizes that evidence and assesses the usefulness of the evidence to change practice. And changing practice is supposed to improve outcomes or to justify what is being used currently. It helps in developing evidence-based practice projects. which eventually goes into the next area, which is clinical guidelines. And I put a list up on this PowerPoint slide to tell you where you can go find clinical guidelines to help in your practice. So in summary, the literature review should determine the need for the replication of a study or refinement of a study, generate clinical questions that guide the development of evidence-based projects. It should help discover conceptual traditions used to examine problems and generate useful research questions and hypotheses, and maybe determine the appropriate design methods and analysis for answering the research question or hypotheses. So as you can see, the review of the literature is very important for the researcher because it tells the researcher what is known and what is not known about anything which they are interested in to research to find knowledge for the profession. It is also important for evidence-based practice because it helps you pull out all the information upon which research has already been done on that which you're interested in to give you information to change practice.